what we've learned is that patients like to recover at home. It's a familiar environment to them, and what we've seen is that it's a safe place for patients to recover. So after surgery, patients go home on the same day. They're sleeping in their bed at home, and we prescribe a period of rest, ice, and elevation to help mitigate the traditional symptoms of pain and swelling after surgery, and it's worked quite well.
Yeah, I think a lot of us think the minute you're out of surgery, you got to start working that sucker back into shape. That's not the case, is it?
Yeah, in my practice, we've actually found the opposite. So people who are very aggressive with their physical therapy really early on, it tends to actually slow them down, creates more pain, more swelling, and they're having to take more pain medications to combat those symptoms. So we really like patients to focus on elevating, resting, icing, so that initial pain and swelling is very manageable. They take less pain medications and they recover quicker.